we are trying to get in front of this opioid, especially opioid. It's more than just opioids, but that's the main thing that's killing our youth today. Just a few years ago, which is the most recent statistics we have, over 33,000 died from opioid overdose. Whether that be illicit drugs such as heroin or the Oxycontin or things of that nature. But there's definitely, it's on the rise. It increases exponentially every year. And as we always attempt to do, and we really want to do in law enforcement in these substance abuse programs, is to get out and be proactive instead of reactive. When our law enforcement has to respond to an overdose, and many times, I myself, in my earlier career in law enforcement, I've been in law enforcement for 40 years, so I've seen a lot of this rise and fall of the substance abuse. We've actually gone to motel rooms and still have the needle in the arm from heroin overdose. But all you have is manufactured drugs such as Oxycontin and things of that nature, which are very good for what they're supposed to be used for. But children and everyone are so prone to abuse of it. Get hooked on it and can't get off. And then the rehab centers are full of kids and even adults today from these drugs. So we want to get out in front of this and try to start going back the other direction as far as the numbers we're seeing, because the last stats we have are 2015, and I think the 2016 just came out recently. I don't have that number with me, but it has increased even more. So we need to get that number going back the other way. One is too many, but 33,000 deaths is crazy. So I want to introduce you here to Susan Anderson, and she's going to talk to you a little bit about the program. Thank you.
Thank you, Sheriff Smith. Thank you all once again for being here today. I want to definitely thank the Smith County Sheriff's Office and Tyler ISD Career and Technology Center. We could not have done this without you and your willingness to sit down and collaborate with us. There are a couple of businesses I do want to thank also. It's Tyler Steel, Fastenal, Locksmith of Tyler, and Sherwin-Williams. They actually donated all of the materials towards this project. So it literally did not cost the residents of Smith County a single dime. And we're really thankful for that. This is just a prime example of what coalitions do. The East Texas Substance Abuse Coalition, we are made up of members in the community working together collectively towards one common goal, and that is to prevent and reduce youth substance abuse here locally. We have members that represent lots of different sectors, from media, law enforcement, business, healthcare, parents, youth, educators, and the list goes on. Substance abuse is a really complicated issue. There are lots of stories, lots of reasons why people begin using, lots of ways or reasons why they become addicted. I mean, we don't know all of those, but what we do know is that this touches the lives of so many people across our nation, and we want to be able to stay ahead of it. So I feel like substance abuse is something that there's not one entity that can tackle it on their own. We have to rely on the knowledge, the resources, and the skills of our community partners, of our coalition members, to come to the table and come up with real tangible solutions. So our coalition, we focus on underage drinking, marijuana, synthetic marijuana, and prescription drug abuse. And of course, today's efforts, this has got to do with us trying to stay ahead of the opioid crisis. And so Brittany Parmentier, she is our chair of our prescription drug task force. She is also a professor at the Ben and Métis Fish College of Pharmacy at UT Tyler, and she's going to come up and talk a little bit more about the issue and how you all can help us. So thank you.
Thank you, Susan. So she introduced me, but I'm a clinical assistant professor of pharmacy at the UT Tyler College of Pharmacy. So I work a lot with prescription drugs and prescription drug overdoses. Prescription overdoses, especially with opioids, which are a pain medication, have risen drastically over the past decade. Drug overdose deaths continue to increase in the United States. In fact, according to the CDC, From 2000 to 2015, more than 500,000 people died from prescription drug overdoses. More than 6 out of 10 of those were due to opioids. And then since 1999, the number of overdose deaths involving opioids, including prescription opioids and heroin, have quadrupled. So it's obviously a problem in the United States and here. So why is prevention important? Preventing prescription and substance abuse is easier than rehabilitating someone after they're already addicted to medications or other drugs. So it's very easy to get prescription medications. There's a higher availability of prescription drugs, especially opioids, means there's a greater quantity of these drugs in our communities. And these have the potential for illicit use. Research shows that most teens who abuse prescription drugs actually get them from friends or family, whether the friends or family know or not. So how do these drop boxes help? So the mission of our prescription drug task force is to significantly decrease the abuse of controlled prescription drugs among youth in our community through education and the provision of safe disposal methods for residents of Smith County. So these receptacles provide safe, year-round use disposal options for our community members and exist in communities all across the country. And we're very happy to have one here now in Tyler. There are many reasons why you might have prescription drugs left over in your cabinet at home. The doctor changes the prescription, you have some left over, they expire, or if someone passes away suddenly and you're left with a lot of medications. And many people don't know what to do with all of these leftover drugs. So having these drop boxes provides a huge benefit to our local community. It reduces access to addictive medications for accidental or intentional misuse and overdose by youth and others in the home. It potentially reduces illegal narcotic sales because we're getting them off of the streets. It decreases water contamination due to pharmaceutical waste that are flushed down the toilet and from being in our landfills. And then it provides an opportunity to educate our community on the dangers of these medications if they're left in homes or improperly discarded.
So this is what we're talking about as far as the drop box. We will have one here at this address here at our administration office for the Smith County Sheriff's Office, 227 North Spring Avenue. We also have a second one on Spur 248 at the Emergency Operations Center, or what we call the 911 building, where our dispatch and patrol for the Smith County Sheriff's Office are located, which is on Spur 248, just beyond the Department of Public Safety office. So that one will be accessible 24 hours a day, 7 days a week. This one is accessible only Monday through Friday, 8 to 5. But we will treat this as we take it from here and properly discard it as it needs to be done, just as evidence. It'll be discarded, abandoned property, but our evidence custodian here at the Sheriff's Office will be the one that monitors what comes in and the weighing and the final destruction of these prescription drugs. So, any questions? You're already easy this morning. Yes, ma'am.
What can go in and can't go in boxes?
Any prescription drug can go in. We'd prefer it to be in some kind of container, at the very minimum, a paper sack or something. We'd prefer it. You can tear off your label with your name on it and things of that. You can take that off there. We don't need that on there. We don't need to know who it came from. We're not going to ask any questions who it came from. But we would like for it to be in the original container, if at all possible, just to make it easy for our evidence custodian to package it properly to be finally discarded.
I was going to say, just to kind of officially kick this thing off, we actually have a Tyler resident.
All right, so we have a resident here that wants to discard something, to be the first one to break this box in right, and so. Thank you very much.
Thank you. Yay.
That's all there is to it. come in the door here. You don't even have to talk to our person here in the lobby. Just hang our left in the lobby right here, come over to the place to discard it, drop it in and leave. No questions asked. So, any additional questions?
I have one.
Yes, sir.
Do you plan to have more across the city as time
Well,
progresses?
We believe 2 is good a number for the sheriff's office. We have them in our 2 major locations where we have personnel. I believe that there is some talk from the city of Tyler, the police department, of seeing how this works for us and then possibly buying into the program. I feel pretty sure that Chief Toller will most likely do that once he sees how successful we believe it's going to be. And you know, you can't, there's a lot of things you can't measure. You can't measure how many drugs we get in here, what was prevented out here on the street. But you have to think and have to believe that potentially there's a great possibility of preventing accidental ingestion by a juvenile child or someone even under 10 years old. So I think it's a good program. We were happy to participate and very thankful that the coalition came up with this program and glad to be among the cutting edge of what's going to be happening here in Smith County and look forward to the whatever we can do to think outside the box to do anything else we can help to prevent the overdose and especially the epidemic that's going around. As Susan said, I think it was Susan said, that the treatment is much more expensive than getting rid of drugs. I think one of y'all said that. But I can tell you from even trying to get people into treatment centers now, the treatment centers are overflowing. There's a waiting list. There's especially a waiting list of the ones that we have in the Smith County Jail that are hooked on drugs. And the best way to prevent it is don't let it start to begin with. So it's going to take many things to stop the epidemic. This is one of many that we can do, but we feel very good about doing it and think it's what needs to happen here in Smith County.
Question.
Yes, ma'am.
Will these be weighed and measured? Who's going to keep statistics on those? Is there going to be any sort of, like in a month we collected
Yes.
X number of?
As I said, our evidence custodian here at the Sheriff's Office, the one that would package and forward to the laboratory our evidence in a criminal case, will be the same one that oversees these boxes. So they will periodically, I'm not going to tell you when they empty them or anything of that nature, but they will keep statistics on how much has come in that will be weighed and packaged just like any normal evidence that would come in. Again, we don't want people to even leave their names on here. We could care less who you are. Take that off. All we want to know is what the amount of pharmaceutical drugs that we've taken off the street, whether it be expired or just some that's not needed anymore. You don't want laying around for children or even adults, teenagers to get addicted to.
Question.
Yes, ma'am.
What about syringes, drug syringes?
No, we do not want syringes. That's something that needs to be put in a sharps box, especially, I'm assuming you're talking about used syringes. There's so much potential for all kinds of diseases, and when we do search warrants on drug locations and things now, we're very conscientious of searching, and we've had officers that have been accidentally stuck about syringes. So no, we don't want syringes. Just the drug itself, capsules, caplets, tablets, and things like that. And I'm assuming we can take in the liquids as well, as long as they're very well contained in the original container.
We can also take prescription patches. There's pain patches out there, so those can be disposed of. The other main thing we cannot take is inhalers, anything that has an aerosol container, and that's due to how the medications will be disposed of. On the front of the box, there is a list of yes, we can accept and no, we can't accept. So in case people forget before they drop them off, they can quickly look through the list.
And everybody should have received one of these today. It's the agenda, but also at the back of it, it's a handout And it specifically goes through different ways to prevent misuse and abuse. And it really points people directly to these locations of these boxes. And so we're just asking any healthcare provider that's here today, if you could, go back to, where you work and just really encourage your physicians or people who are prescribing these opioids to also hand out this information and letting people know the importance of disposing them properly, and these are the places that you can dispose of them.
Anyone else? Again, thank y'all very much from the media for showing up here this morning. You're the best vehicle we have by getting this information out, and we appreciate your willingness to do so, and look forward to a successful program. Thank you.
Thank you.